So Connected Health Cities is a programme that's been funded by the Northern Powerhouse. So we're all watching the comprehensive spending review with interest, because there was a little asterisk on the £20 million that's earmarked for the North that said subject to the comprehensive spending review. So fingers crossed, Simon Stevens will have done a good job for us, and this afternoon the money will come through. But we hope that by impacting on our data and using it with frontline staff, will accelerate business growth, because staff will understand how we can use data and technology to keep residents out of hospital and to treat them well when they're there. Develop some of our region-wide health science. How do we use that data to further health and to get ahead of the game for our patients in great treatments and technologies? And also to build trust with our citizens. Can we as a North have a dialogue with citizens across the patch to say, look, this data we've got is fabulous, it can improve your care and that of your relatives, how can we actually do that together? So the Connected Health Cities pot of money is £20 million over 3 years. There are 4 academic health science networks in the region, and we've all been bidding for that money. And we have worked together really closely with university partners, provider institutions, to make sure that our bids are coordinated and that we can impact and share good practice across the North. So how does that all fit with the European Connected Healthcare Alliance? So the Alliance is a community and a movement across Europe, North America and now China that brings together professionals that are working in the e-health and n-health space to impact on our residents. So all of us in the room through the AHSN and through some of your organisations are part of the Alliance. And there are 300 plus member organisations. And I know that people in the room have really benefited from the links the Alliance has. So if you're wanting a European partner for a bid, the Alliance can source that. If you're working up a technology and you're thinking, I'm just not getting very far with this, I don't know how to progress, there's normally a partner in the Alliance who can give you some advice. So it is a service that we use to link people with. And they're linking with lots and lots of businesses. So as well as you in the room, they're linking with all these businesses who we can learn from, and also use the products if we've got a gap in our market in the North West Coast. And I'm sure Hakeem will talk to you about the Northern Health Science Alliances and the business it deals with as well, and how we can maximise working together and use open innovation for the benefit of our residents. So why do we as an AHSN, why are we part of the European Connected Healthcare Alliance movement? So we've been focusing on the last 2 years on a number of healthcare and social care projects, and we're now focusing down onto digital health. So over the next 2 years, we're going to be working with our partners who are running innovative care models. You'll have heard about the Vanguard sites. We've got lots of transformation programs across our patch. How do we help them to accelerate that excellent health and social care that we want for residents? We're going to be working with our innovation hubs across the patch and developing them, so that if we have got something that's at an early stage, how can we really accelerate that into the marketplace for residents? And all of that contributes to driving economic growth. So we want our region to thrive, we want money to come into the North, we want businesses to locate here, and we want to equalise the outcomes for our residents in terms of their health. So we're rebranding, along with everything that's going on, we're going to rebrand, and this is our suggested rebrand. So we're moving from the North West Coast Academic Health Science Network, which is quite a mouthful, and you have a massive badge saying that on, hopefully to the Innovation Agency. We just think that's a lot clearer. Our logo, the blue and the green, reflects the fantastic region we've got here, so that we've got the blue of the coast and we've got the green of the wonderful countryside that we've got across the North West Coast. Now, most of you in the room have worked with us, and I'd just like a show of hands actually, whether you think this branding is something that will take us forward into the future, and whether you would be supportive of us adopting this branding for our next iteration of business. So can I just have a quick show of hands? Right. This feels like The Apprentice, you're hired. So that was all, and you're hired then. That's a good logo for us. So that's brilliant. Thank you, colleagues. And any suggestions about that? If you think there's anything missing from what we're proposing to do, please do speak to one of the staff in the room before you leave today. So the European Connected International Network, I've talked about it a bit, about how it connects health ecosystems, and there's 100 plus gatherings like this going on across Britain and across the world. So we're part of a really big network that can support us. Liz Ashell-Payne from the network is joining us today. I think she's been held up in practice, but Liz is a representative today who you can chat to if you want to join individually, or if you want to use your membership through the AHSN to make links across the patch and across Europe. So the programme, we've been running these events since November 13, and there's something about our coherence as a North West Coast region. When we come together, we know that we can make a difference in our region and beyond. We've got multiple different stakeholders, and we have regular meetings and workshops in between. And the Alliance have these meetings going on all over the world. And they also have working groups. So we're an integral part of the Medicines Optimisation Working Group. And some of you in the audience will have met Professor Mike Scott. And Mike's been working with us on adopting a system across the North West Coast called Step Select, which is about stratifying medicines. There's also an e-health strategies group that Liz will be able to talk to you about if anybody wants to be part of that group. And for us in Connected Health Cities and for our work in the North West Coast, it really expands our network. And as an AHSN, we don't see ourselves as a small group of staff that work within the hub. We see ourselves as an expanded network of innovation scouts, people through the Alliance, yourself in the room, and we're all working together for the same aim of improving health and care. So the Alliance have just this week launched their Connector platform, which is a database where you can connect with lots of different people. You can connect with them through webinars and workshops. You can go on for a matchmaking. If you want a partner for your European events or some work you're doing in Britain, you can do that through the database. There's a business intelligence tool on there to capture market data. So it's a really key development for this community of interest. So when Liz comes in, we'll have to have a fanfare so that you can see Liz Ashell Payne for people who don't know her, and it's worth asking about this database and how you play into that.